So, what is a pedophilic disorder? That's what I'll be teaching you about today. It's a very misunderstood disorder, holds a lot of controversy around the world. I'll be going through a general description of it, diagnosis information, and some additional things to keep in mind. Major symptoms of people who have this type of disorder. I'll be going through prevalence rates, so how common is this, based on my own research and what the DSM-5 states. I'll be going through differential diagnosis, so how this type of disorder shouldn't be confused with anything else, although they do show similar symptoms. Common treatment approaches. I'll be going through a psychotherapy approach that therapists typically take with these individuals. I'll also be going through a pharmacological approach that psychiatrists tend to take, and usually those two work together to try to help these individuals. Let's go through a general description of what a pedophilic disorder actually is. So in the DSM-5, it's understood to be a paraphilic disorder. It's characterized by persistent and intense sexual attractions to prepubescent children, typically under the age of 13. It's usually diagnosed when these urges cause distress, interpersonal difficulty, or result in harmful actions. And I'm sure you can figure out what they mean by that. However, it is important to remember that not everybody with a pedophilic interest commit offenses. There are people out there who do not commit offenses and they get help, they go to therapy, and they learn how to manage their disorder. They try to get better. Some additional information regarding this diagnosis is also that it is important to remember that pedophilic interest alone is not enough for a diagnosis. The person experiencing this type of disorder should show significant distress or impairment, or they may have acted on their urges and they need help. Actually, a lot of help in that situation. I'll be going through a type of drug that they use to actually suppress testosterone in some of these individuals in high-risk cases. So, the DSM-5 also distinguishes between those who experience these desires but do not act on them, to those who engage in illegal sexual behaviors. So both of those are different. They are not the same thing in the DSM-5. Some major symptoms of this disorder, which I think are important to remember when trying to understand, is recurrent, intense, sexually arousing fantasies, urges, or behaviors involving sexual activity with a prepubescent child for at least 6 months. So that's the first part. Second part is acting on these urges or experiencing significant distress or interpersonal difficulty due to them. The third part is the person must be at least 16 or 5 years older than the child they are attracted to. So it's important to keep in mind that some of the people who experience a pedophilic disorder will be minors. Some of them are 16, they are in high school. So that's something that is interesting about this and we should keep in mind. Additional symptoms, which aren't in the DSM-5, aren't specifically put in there, but that I think are important, are to remember that they have cognitive distortions. Usually many of these individuals with pedophilic disorders may justify their thoughts or actions, believing that children can benefit from sexual experiences or that mutual affection exists. And of course, this is absurd. And in the next slide, I'll actually be showing an example of, just to give you an idea of what these people tend to think about. They have compulsive preoccupation, so they spend excessive time managing in pedophilic fantasies, consuming explicit content, or attempting to engage with children. They have impulsive control issues, difficulty suppressing urges or fantasies, and they constantly think about committing inappropriate actions with these individuals. So this is an example of a cognitive distortion from one of these individuals, which I have found through the Wayback Machine. And as you can see in this slide, I would ignore most of everything that is at the top and really look here at the bottom, where this is typically what you'll hear from these individuals. And it's not all of them, but it is a few. So this person states, I'm all for improving their quality of life. I think the best way to do that is to allow them to make their own decisions. Why can't I support a better quality of life for children and allowing children to choose to have sex if they so desire to, with adults at the same time? And this is an argument between two individuals, someone who does not agree with this person, someone who is pro-contact. This is what they would identify themselves as. So now you have an idea of what these people may actually talk about. Let's go through prevalence rates. So how common is this type of disorder? It may seem like there is a lot of people struggling with this. However, that is not true. Although data regarding pedophilic disorder was challenging when I was going through this due to underreporting, as you can imagine, because of the stigma that people face. A German study did find that 5.5% of men reported sexual interest in prepubescent children. I think that's something we should keep in mind, considering that, there's people out there who don't fit the criteria for this disorder, but they do experience this. And this is self-reported. It was from the internet, so I'm not sure how accurate it is, but I don't know how people answered. Research from Serbia also reported that 2.13% 30 to 50-year-olds in the general population, including women, did also show sexual interest in prepubescent children. So it's important to also remember that while usually this type of disorder is diagnosed toward men, there are rare cases where it is women. And I'm sure it's a small amount, but a small percentage of the general population is thousands of people. So there are a lot of people suffering with this type of disorder, including women. The DSM-5 overall states that 0.5 to 3% of adults male meet this criteria for a diagnosis. Now you may be thinking why the DSM-5 includes adult males specifically, and that's there because usually this diagnosis is toward men. Cases in females are a rarity. That is something that is stated inside of it. These are some of the sources I utilize to support my prevalence rates. The first one is the German study. As you can see, it is self-reported. So the Serbian study as well, which looked at the general population. So I took a differential diagnosis according to the DSM-5. Distinguishment from psychiatric and neurological conditions is important to remember while going through this. Individuals with OCD may experience intrusive sexual thoughts about children, which they find highly distressing, but they do not desire to act on them, which is the main reason why it does not fit as a pedophilic disorder. These people, what you want to keep in mind is that these people usually are more focused on the fear of being a pedophile rather than actually acting on their urges. So they have a lot of anxiety regarding how they're going to behave, although they don't have any history of it. They may not even have fantasies. They may just have thoughts that they are pedophiles, and it causes them extreme distress. Substance-induced sexual disorders is another one. Methamphetamine, alcohol, and cocaine do cause disinhibited sexual behavior sometimes, including inappropriate actions, which do include sexual advances towards children. However, this does not fit the diagnosis for a pedophilic disorder since it is induced by substances. These are people who do not constantly think about these things. They only perform these type of actions under substances, and sometimes it might not even be children. It may be adults. So, antisocial personality disorder. Some of these individuals do engage in sexual offenses against children due to a disregard for others without experiencing any preference for children. It's important to remember. They would probably abuse adults. They would probably abuse animals. They're not going toward children because they have a preference for them. They may be easier targets. So it's differentiated from a paraphilic disorder. Common treatment approaches. Now we're nearing the end of this presentation. It's CBT, behavioral therapy, social and emotional skills training, and 2 drugs, which I did say that I was going to go over and do tend to suppress testosterone. So treating an uncurable mental condition. This is something that we should all keep in mind. There is not a cure for this disorder. Somebody cannot wake up one day and say that they don't have a pedophilic disorder anymore. They cannot be cured. They can only learn to manage impulses and develop coping strategies. They can learn that through CBT. Behavioral therapy is another way that therapists will deal with this. It's negative reinforcement techniques to reduce sexual arousal toward children. They'll teach them social and emotional skills training, which enhance their self-regulation skills and emotional control. Pharmacological treatments, anti-androgen medications, medroxyprogesterone acetate and cyprotrone acetate are proven to lower testosterone levels, which significantly reduces sexual drive and arousal. Usually these type of drugs are used for people who commit sexual offenses because on a biological level, testosterone does make people more sexually driven, and we can see that in society from more men than women. Gonadotropin, releasing hormone androgens. These type of drugs actually suppress testosterone production, and they're usually used in high-risk cases. They're used in situations where a person experiences like extreme emotional distress, so they constantly think about it. They're thinking about acting on their urges. Maybe they have offended in the past, and they'll go out there, and so they need to use these medications. And it's also important to keep in mind that usually what will happen with these individuals is they'll be sent to a psychiatrist, and then they'll be sent to a therapist for psychotherapy. So they'll do the 3 things that I described here, and it'll be combined with pharmacological treatment so that they can get better. So these are conversations between a therapist and a person who may fit the diagnosis for a pedophilic disorder. These are podcasts that I listened to when I was going through my research. The first one is an individual, a single male, and he states that he has a sexual attraction to children, and it is quite disturbing to listen to. But the therapist does make a lot of pauses, so if you want to listen to it, but maybe you've gone through things, or it can be highly triggering. But the therapist does make a pretty good job while going through interviewing these individuals. The second one is a divorced father with a son. Both of them are psychology in Seattle. Interview with a pedophile father. Search that up on YouTube. And you'll find both of these interviews. I think it was important to put both of these in there because typically what the public will think is that these people don't have wives, they don't have families, they don't have children, and that is not true. Some of them are single, male individuals, right? No children, nothing. Some of them are fathers. They do have families. So that's important to understand. And here I've set up a kind of a board to show you what the sociological perspective on this would typically be. So most of it is pretty psychological. It's mostly about how people's thoughts and emotions influence their behavior, right? But I think for this type of disorder, it is pretty biological. It doesn't seem to be it doesn't seem to be induced by sociological, like it doesn't seem to be induced by sociological experiences. So for example, if we go back to the first slide, we'll see that in the first interview, I can kind of summarize it. The person was saying that when they were a child, right, as they were growing up, this person was sexually offended by somebody older than them. And this person learned that this is how you connect with people. So this is the sociological approach or the psychological approach, right? The psychological perspective. And then this person went to school. And at school, they were with other children. And with these other children, they ended up sexually offending them. And this is something that will happen. There is such a thing as children sexually assaulting other children because they themselves have been sexually assaulted by a family member, and that's what they know. And so in the first interview, the individual, the male, which I was talking about, that person, from my understanding and from what the therapist has said and how he said that it kind of develops, the sociological approach seems to be that this person grew up, and then when they were an adult, they came across another adult, and it was a woman, and they didn't feel any attraction toward this person. They still felt an attraction over here. And so what this makes me think is that what's going on with this person at a sociological level is that they're experiencing a lot of stigma, a lot of confusion in their brain. They don't understand how they develop these urges. They don't understand why this is happening to them. So mentally, they are still over here. They're still this child. And they still believe that this is the type of thing that they're in, even though they're adults. So this is the psychological approach, which I think influences a lot of these behaviors. But in the second interview, if you listen to the father, he states that when he was a child, actually nothing happened to him. He was just a kid, right? Going to school. He was just going to school, doing his thing. He didn't really go through any traumatic experiences. He didn't really go through anything. He just kind of says that when he saw children, he noticed that he would have a sexual attraction to them. And it made him think that he could be a pedophile. And he didn't know what to do about it. He had a woman that he met, and he married her, and he had children with her. And this person has a son, and this person identifies as a pedophile. I think they fit the criteria for a pedophilic disorder. Both of these individuals said they went to therapy. They didn't disclose if they do fit the criteria for a pedophilic disorder, so I don't know, but I'd assume they do. And so what we see here is that this individual has the same disorder as this individual, except this individual went through trauma. They went through traumatic experiences which influenced their behavior and their emotions and their thoughts, and then they grew up and they were like this, and they didn't feel anything for adults who they are supposed to be attracted to. They still are here. And these people just are internally suffering forever. They may not commit a sexual offense ever. They're just not able to engage in fulfilling relationships. They're not able to do anything in their life. And if they tell anybody, they may face violent repercussions, right? And some of these people, if they never get help, they will commit a sexual offense. Some of them will. And these are the people that we typically see in jail, right? We see them locked up. So something important to keep in mind is that there is a lot of people who are walking around and they are normal and they have families, and some of them did grow up like this, and they do fit the criteria for this type of disorder. And you may think that they're normal, you may think whatever. Usually the only people that we see are the people who go to jail. We don't see the people that don't offend. We don't see the people who have families and have children themselves, and they take care of them and they're suffering. So that's important to remember. It's important to remember that what seems to really motivate this disorder is biological. It doesn't seem to be very influenced by social experiences. Although it is, there's a psychological and social factor to it, but it seems to be more biological. So, just things to keep in mind. Thank you for your time. Thank you for listening. Thank you for I kind of went over the mark. Probably lose some points. Uh, Thank you. This has been great, and I enjoyed going this deep into it, although it did take a long time to go through. But I'm glad I made this. I hope you're better informed about pedophilic disorder now.